Often people confuse school-based health with school-based health centers, or sometimes called clinics. For this reason, I want to explain the difference. School-based services began with the inception of the Individuals with Disabilities Education Act, commonly known as IDEA. According to IDEA, the purpose of school-based services is to provide educationally necessary services to special education students to access classroom instruction in order to receive a free and appropriate public education. Unfortunately, public schools have misused school-based services by providing medical treatment to special education students on campus. This misuse has been going on for 30+ years. As stated in IDEA, schools are not required to provide medical services unless that medical need is educationally necessary. This federal regulation clearly identifies therapies such as mental health therapy, behavioral therapy, physical therapy, speech language therapy as medical. Therefore, schools have put to wrong use school-based services without authority. Now, let's talk about expansion of school-based services. Remember, school-based services is a federal program for special education students and not intended to be used for students not qualified for special education. School-based centers are socialized healthcare with an anti-parent agenda. When a school applies for school-based health center status, they are practicing outside the professional scope of academics based on the Oklahoma State Constitution and Title 210 of the State Department of Education. Now let's talk a little about background. In 2004, the NEA and special interest groups complained to the U.S. Congress about public schools not having enough money to pay for special education services. They wanted Medicaid to create a school-based Medicaid program. The purpose is to supplement what the federal money doesn't cover by amending Part B of IDEA and allowing schools to bill parents' private health insurance. Now, did you hear that? Private health insurance. Anyway, Congress amended Part B of IDEA. When Congress amended IDEA, one of the conditions required states to give oversight of school-based Medicaid to an agency. In 2013, the Oklahoma Healthcare Authority, commonly known as OHCA, was given oversight of school-based Medicaid services. This change allowed OHCA to manage and streamline the process for providing Medicaid billable services to special education students within the schools. Also, OHCA rules require school audits of school-based Medicaid money and IEPs. However, OHCA has never audited the schools. July 2024, I spoke with an OHCA employee regarding access to their audits. Their employee said OHCA does not audit schools unless they see a need to. This employee went on to say, OHCA and the public schools are collaborating to expand school-based services for all children living in poverty. This raises concerns for intentional and unintentional Medicaid fraud and fraudulent IEPs. We need transparency by way of an audit of the school-based Medicaid money and a comprehensive review of each special education student's educational file and their IEP. I believe the 2004 demand to amend IDEA was the back door to student-focused socialized healthcare on our school campuses. Now remember, school-based services are a federal program limited to special education. There's no legal authority allowing the merging of school-based services with socialized health care for low-income students not eligible for special education. In closing, if you oppose the expansion of school-based services, if you oppose the implementation of socialized health care on our K through 12 school campuses, please contact me at the email address below and find out how you can support our efforts for the 2025 legislative session. To learn more about school-based health centers, use the library link below. Thank you.